you wonder, are there any natural ways that you can control your blood pressure permanently? And do you want to go off of all the prescription medication you are taking for high blood pressure? Can you actually stop your prescription medication using natural ways to control your blood pressure? If that is true, let's dive into it. All right, welcome back to Dr. Moses YouTube channel. Last week, we talked about the real cause of your high blood pressure. And if you don't watch the video, I want you to watch the video because based on the real cause of your high blood pressure, we can come up with natural ways, scientifically proven, to be able to lower your blood pressure. The first scientific proven methods of lowering your blood pressure naturally is going on a low carbohydrate diet. Now, when you look on the internet or on the website of the American Heart Association, they talk about the DASH diet. I'm sure you've heard about the DASH diet before. The DASH diet, which is DASH, it means the diet approach to stop hypertension. And this has been promoted so many years, over the years, and people have been using it, and yet they still have very high blood pressure. Does a DASH diet really work in controlling your blood pressure? There are a lot of studies that has been done, and I'm going to leave some of the links in this video below where they compare the DASH diet with a low carbohydrate diet. And on the studies that was done, they realized that people who on a low carbohydrate diet had a decrease in their systolic blood pressure by about 9 points and the diastolic blood pressure about 6 points as compared to the people on a DASH diet. So they realized that low carbohydrate diet, what it does is that it improves your artery function. And according to a study that was done in Johns Hopkins University in 2012, they found out that after 6 months of people on a low carbohydrate diet, they had more weight loss and decrease in their blood pressure. So what does a low carbohydrate diet do to your body? What it does to your body is that it produces less insulin. And remember last week on our video, we talked about insulin resistance. So because the low carbohydrate diet produces less insulin, it can regulate the sodium retention in your body and promote excretion of the sodium through your urine. And by so doing, the retention of fluid is very less. And guess what's going to happen? It reduces your blood pressure naturally. So a low carbohydrate diet often leads to a weight loss, and your abdominal weight loss is gone. And when the abdominal weight is gone, then guess what? You are no longer in that syndrome we talk about called the metabolic syndrome leading to insulin resistance. And therefore, there is a relaxation of your vessels. There is no contraction of the vessels. And that will lead to you having less fluid retention in your body and therefore reducing your blood pressure. Now, this is not going to happen overnight, but as you practice this, you will realize that in about 2 to 3 months of going on this diet, your body will naturally reduce sodium retention in your body, and therefore the fluid retention will be reduced and your blood pressure is going to reduce. So low carbohydrate diet is one of the greatest natural ways that you can reduce metabolic syndrome, reduce insulin resistance, and therefore the cascade of reaction that I mentioned before will take place in your body. You have low sodium retention, and therefore you will reduce your blood pressure naturally. There are a list of foods that you can take under the low carbohydrate diet, and I'm going to leave a link in this video so that you can go study them and see the ones that work well for you and all the studies that have been done. I'm also going to leave a link in this video for you to go and just study it so that you can be able to help yourself get off those blood pressure medication you are taking. The second way of you being able to reduce your blood pressure is a daily potassium intake, In fact, it has been proven that when you take a daily potassium, and I'm going to give you the amount of potassium that you need to take, be able to see this effect, or the kind of food that you can eat that contains high potassium levels that is going to help you, your body, to be able to go through this mechanism that I'm going to explain to you to reduce your blood pressure. Low potassium level help relax the smooth muscles in your blood vessels. And when the relaxation of the smooth muscles in your blood vessels is going to lead to what? Vasodilation. That is the opening of the vessels. And when that happens, get what? Your blood pressure will reduce. So now the warning though is that if you have kidney dysfunction, or you have what we call kidney failure, chronic kidney failure, or you are on medications like lisinopril or losartan or spironolactone, if you're on these medications, you got to be very careful about eating foods that are high in potassium or taking an extra potassium, because this can cause a very high potassium because your kidneys are not able to handle them, and that can be a problem to your heart. So if you're on these medications that I just mentioned, make sure that you talk to your doctor before you go on a high potassium diet. And also the high potassium diet also helps with excretion of sodium from your body. So instead of you having, sodium reabsorption when you are taking other high carbohydrate diet, when you're on a high potassium diet, there'll be what it reduces the reabsorption of sodium. It actually causes the sodium to be excreted from your body through through the kidneys. And when that happens, guess what's going to happen to you? There is less fluid retention in your body, and so your blood pressure reduces. And again, like I said, it's not going to happen overnight. It's something that you have to incorporate into your diet. And usually the studies that have been done have shown that even people on this kind of diet, high potassium diet, or taking potassium supplementation, even after 2 weeks, they realize they've seen a drop in their blood pressure. And so again, I'm going to leave a list of what's high potassium diet, okay, and how much you need. Now, according to the World Health Organization, by having about 3,500 milligrams of potassium daily, that will help with what I just discussed, the vasodilation property, and also the fact that sodium will be excreted through the urine and your blood pressure reduced. Now, when you go to the American Heart Association website, they give you a diapason. They said between 3,500 milligrams to 5,000 milligrams a day of potassium, either food that are rich in potassium, that will do the same trick for you as well. And in fact, I'm going to leave a list of food substances that are high in potassium, their milligrams, and how much you need a day. And this is going to help you so that you can regulate how much you are taking a day, so you don't overtake the amount of potassium in your body. And so if you do these two things naturally, it's going to help your body regulate the sodium retention and excretion of sodium, vasodilation properties, reducing your insulin resistance. And therefore, you are going to lose that abdominal weight, and you realize that your triglyceride levels will go down. And what's going to happen is that naturally you are going to maintain your blood pressure. And the warning is that when you start doing this kind of diet and your blood pressure is going down and you're on many blood pressure medications, you need to call your doctor and let them know your numbers, and they can help you slowly wean you off these medications. And this is the long-term solution to the silent killer, high blood pressure. And I tell you, if you go on these two processes that I just described, you will go off your blood pressure medication. So if this information has been very helpful to you, I want you to subscribe to my channel and also give me a like. Now, if you've tried these two principles that I just described and it has worked for you, I want you to leave your testimony in the comments below so that other readers and listeners will learn from what has worked for you, and so that they can also go off their blood pressure medication that comes with high side effects. So until then, this is Dr. Moses. I say you stay well.